My name's Rob Heaslip. I'm the Area Manager for Hume Region Ambulance, Victoria, and I look after Wangaratta, Benalla, Mansfield and the Alpine region during the winter. The Can-Am's been a development we've been working on for the last 3 years. What they needed to be able to navigate was the very unique snow environment in Victorian snowfields. So whether that's really packed, slippery ice, or indeed the melting snowfields where often rocks and other debris are protruding through the snow cover, a machine like this that can actually traverse any type of terrain was really important to us. Previously, we were using skidoos, so that motorbike sort of format for transport, which was really challenging because they only take one person. We literally had a homemade type of steel stretcher. It was a bit of a sled, and then we would have to stop every 5 or 10 minutes and just check on their condition. So very suboptimal in terms of patient care. Consultation for the development of this vehicle has been really extensive. Of course, we started with our responding paramedics and the staff on the mountain to make sure that we understood all the different and diverse challenges. Then we had to find a vehicle that had the ability to travel to the certain areas that we needed under all those different conditions. The ready-made vehicles and solutions were on the market weren't suitable. Rather than trying to figure it out ourselves, we consulted extensively with the CFA, who have developed similar vehicles over the years, but also the police and Snow Patrol. Once we'd identified the vehicle, it was then trying to adapt the vehicle to all those different needs. Perhaps the most complex part of the design and the build was having an engineered solution that met Australian vehicle standards, so the vehicle can be used on roads as well as the ski fields. And what we're looking at in the background here is actually the third version of what we're able to build.
So the earlier models came in to see if they would cope working in a ski environment with the added weight, the equipment required. Some of those earlier models were not quite up to spec. So we have seen some changes across the years. With now the final model, it does have a much better responding capability, upgraded suspension, a better environment for both patient and paramedic and driver.
When we get this machine, it's actually got wheels on it. Obviously wheels don't work on snow, so that's why we fit these Apache tracks. They're quite widely used on these vehicles up in the snow. It's quite loud inside, so the vehicle has a 4 headset communication system. The loading a patient can be done with 2 people, with the sked and the ramp and the winch, whereas how they used to do it could take up to 4.
It's not only safe for the patient because they're inside a vehicle, but we're also protected from the elements. We're warm, we're dry, we can hear each other, we can respond to situations much better. We've got proper lighting, we can drive in all conditions, so it's a much safer environment.
A really important part of this process was the collaboration of so many different departments within Ambulance Victoria, from health and safety to fleet services, our manual handling coordinators, to our responding paramedics, through to our engineering partners in Motor International. So there has been a huge amount of work go into this, but our biggest success is the safety that this affords our Alpine paramedics.